Hi everyone, I'm Srishti Trihan, a clinical psychologist with a passion for helping people navigate their mental health journeys. Today we're tackling a topic that's often misunderstood: the difference between sadness and depression. They might seem similar on the surface, but understanding the distinction is crucial, especially when it comes to knowing when to seek help. So let's break it down in a clear, straightforward way. Sadness is a normal, healthy emotion. It's your brain's way of responding to something upsetting or disappointing. Maybe you did not get the job that you wanted, you had a falling out with a friend, or just watched a heart-wrenching movie. We've all been there. Here's the key. Sadness is temporary. It comes and goes, and even in the middle of it, you can still usually find moments of joy or relief. Sadness does not take over every part of your life. It's more situational and tied to specific events. Now, depression is a whole different story. It's a medical condition that affects your mood, thoughts, behavior, and even physical health. Unlike sadness, depression can feel all-encompassing. It sticks around for weeks, months, or even longer, and it does not always have a clear trigger. Some common symptoms of depression include persistent feelings of sadness, emptiness, or hopelessness, loss of interest or pleasure in activities you once enjoyed. Even your favorite hobbies can feel like a chore. Changes in appetite or weight, either eating too much or too little. Sleep disturbances like insomnia or oversleeping. Fatigue or low energy even after a full night's rest. Difficulty concentrating, making decisions, or remembering things. Thoughts of self-harm or suicide. If this applies to you, please seek help immediately. Sadness is temporary. Depression lasts for an extended period, at least 2 weeks, or often much longer. Sadness can feel intense but usually does not interfere with your daily functioning. Depression, however, can make it hard to get out of bed, go to work, or maintain relationships. Depression often comes with physical symptoms like fatigue, changes in appetite, or unexplained aches and pains. Sadness typically does not. Sadness is usually linked to a specific event or situation. Depression might not have an obvious cause or can occur even when life seems fine on the outside. Understanding whether you're experiencing sadness or depression is essential because it influences how you handle it. Sadness usually resolves on its own with time, self-care, support from loved ones. Depression, on the other hand, often requires professional intervention like therapy or medication. And let's not forget, untreated depression can worsen over time, affecting your physical health, relationships, and overall quality of life. That's why early recognition and action are so important. So how do you know when it's time to get help? Here are some signs. You've been feeling low, hopeless, or disconnected for more than 2 weeks. Your symptoms are affecting your daily life, work, school, relationships. You are experiencing physical symptoms without a clear medical cause. You have had thoughts of self-harm or suicide. If any of these sound familiar, reach out to a mental health professional. Seeking help is not a sign of weakness, it's a proactive step towards feeling better. Here's something I wanted to emphasize. Struggling with your mental health is nothing to be ashamed of. Depression is a common, treatable condition. According to the World Health Organization, over 280 million people worldwide live with depression. You're not alone and help is available. Just like we care for our physical health, we need to care for our mental health too. Therapy, support groups, medication, or even lifestyle changes like exercise and mindfulness can make a huge difference. If you are unsure whether you are dealing with sadness or depression, don't hesitate to talk to someone, whether it's a trusted friend, family member, or a professional. The earlier you address it, the better. Thank you for watching. If you found this video helpful, give it a like, share it with someone who might need it. and let's keep the conversation going in the comments. What questions do you have about mental health? See you next time, and remember, your mental health matters.